As was already mentioned that we were at the end of this meeting. We have now 45 minutes again, so we have time till 5:30. So this is not going to happen again. Waiting for Dr. Amit to enter the meeting.
I think so only 26 have joined yet. Just wait.
ये इतना खत्म कैसे हुआ बे?
Friends, the government has only decided only 40 minutes to be given per meeting. This Zoom app.
Oh.
Yeah.
अच्छा.
इस ऐप के ऊपर हमको सिर्फ 40 मिनट मिलेंगे एट अ स्ट्रेच. उसके बाद वापस रिकनेक्ट करना पड़ता है. दैट इज द ओनली प्रॉब्लम विच वी हैव. या ओके. So it's a free app. So it's a free app. That's why.
Okay.
Justin, you can start. Justin, you can start. Unmute Dr. Dharmaji sir. Let him ask the question to Dr. Amit. Okay?
Yeah, I was having a question from Dr. Dharmaji. Can Dr. Dharmaji come again?
Dr. Amit, just wait a minute. Justin, please unmute everybody.
Yes, I'll mute everybody.
Sorry, mute everybody.
Amit, sir, you can answer.
Yeah. I did not get the question. Can I get the question?
Okay, I am not able to see Dharmaji sir right now. There is one question which says how to fumigate the clinic with or without the machine. Should it be done daily or on alternate days?
Okay, now if you have a defogger or the fumigator, then you can do that. In today's scenario, I would say yes, you do it every day. But otherwise, you can do it twice a week. Now, if you don't have a fumigator or a defogger, then in that, the way I do, I can tell you, and I've been doing it successfully, and how I'm successful, I can prove it because I take a culture swab of my clinic and send it to the lab, pathological lab, and there they give me the report saying that what are the microbes which are growing and what are not growing. So some are opportunistic microbes and some are contagious microbes. So if there are differences there, then I do not worry about my sterilization. Now, how to do that? I use a small stainless steel bowl. I pour almost 100 ml of formalin. Now this formalin is the same formalin which you use for preserving the tissue during a biopsy. So if you can use that, and it is readily available at your nearby chemist or any big chemist. And on top of that, once I place that, I pour a teaspoon. I have not measured 30 grams, but I generally pour a teaspoon of potassium permanganate. But at the same time, you have to be very careful. This is the last thing which you do in your clinic. The moment you place this and put it in the center of your clinic, you just have to leave the clinic. The reason behind it is the moment the reaction takes place, there are very pungent fumes which come out, which can cause irritation to the eyes. Now, there was a question that will your electrical appliances get spoiled because of that? Well, when I leave my clinic, I cover my laptops, and if there are some lumens or something or some cameras are there, I consider. But CCTV cameras are there since so many years, and I haven't seen any type of corrosion till now. So I've been doing it for almost now 10 to 12 years.
Okay, Dr. Amit, there is a question from 2 or 3 members. How to sterilize lab work like crown and bridges?
Okay, now to sterilize your crown and bridges, you can dip it into sodium hypochlorite baths, or at the same time, you can place them into formaldehyde chambers. Again, I have told you how to do that. See, India is a big country of jugaad. So if you don't want to spend much onto all these formaldehyde chambers and all that, what you can do is take a box, place some formalin tablets in that, cover those that tablets with your gauze, and on top of that you can place your lab work, which you can decontaminate them.
Yeah, Dr. Jashan,
Dharmaji sir, you
Dharma,
had a question.
Yeah,
Dharmaji sir.
Dharmaji sir, I can see you. Your question was half
Yes.
heard. Sorry. Please repeat.
Sorry, Amit. We got disconnected exactly at that time.
Don't worry,
My
we are
question was,
always connected.
there are a lot of different and uh, reports about the medications actually which are either newly discovered or old malarial anti-malarials which are very effective on corona. What is your view on that?
Okay, now regarding this, sir, the thing is, we have there are various reports which say that anti-malarials, chloroquines 200 twice a day, twice a week is a preventive measure. At the same time, you have some various antiviral drugs, but there is no sure short reports from the WHO who say that
Okay.
these are the medications which can be used for curing or preventing corona. So I will not believe on these things until unless I get an authentic report from WHO or any of the medical associations.
Uh,
Okay. Right.
Dr.
Thank you.
Dr. Amit, Dr. Saurabh Jain is asking, is there any efficacy in sterilization between fumigation and quaternary ammonium compounds?
Come again, I didn't get you.
Is there any efficacy in sterilization between fumigation and quaternary ammonium compounds?
Okay, now the most important thing which I think I'll just go back to my presentation over here. See, basically, when you use your benzalkonium chloride, what exactly you are looking for? You are basically using it to disinfect instruments or disinfect areas where you can reach. Fumigation is for those areas where you cannot reach in, where areas where you need to know that the only the fumes can reach over there. So I think these are two separate things. You can not say that you are going to use only fumigation and you are sure shot away from all type of infections. You can use both of them or either of that. At least I believe something is better than nothing.
Thank you, Dr. Amit. Dr. Rajesh Kamdar is asking,
I have a
Dr.
useful
Rajesh Kam,
question as well.
yeah, 1 minute. Dr. Rajesh Kamdar is asking, how often do you take culture swabs?
I take once in a month.
Okay.
Okay. There's a
Yeah,
question
Jashan.
which comes up which says that how useful is the UV chamber and should the instruments be continuously left in the UV chamber?
Okay, now as I told earlier, there are various UV chambers which are available in the market. You have to be sure that it is a UV chamber and not just a blue tube light inside. Because many a time you've seen many clinics, and I have been visiting, that it's basically a showpiece and nothing else. UV chambers sterilize the instrument within 1 hour of actual UV radiations. So you don't need to keep
Amazing.
it on for more than 1 hour.
Yes,
But
yes,
at
right.
the same time, you always see to it that you're not placing any, uh, you're not placing anything which can.
Please don't
Uh,
share screen. I would request everyone else to stop share screening this time. Thank
yeah.
you.
Okay. So basically, it is only not more than an hour to leave your instrument into this UV chamber.
Okay. Dr. Amit, there is a question. Is it true that Nsaids should not be used in viral infections? If it is true, which should be a routine analgesic?
Okay. NSAID should not be used in a viral infection. Yes, it has been true that you should not be using. And nowadays, when you see all these things which has come up into WhatsApp, that ibuprofen in Italy, people were using ibuprofen, and that's the reason the viral infection increased or multiplied much more, and they were effective about that. But at the same time, I always say that whenever you have a viral infection, that means you are having fever. And when you're having fever, there are patients who have been on all type of NSAIDs because to bring down your fever. So in that case, I will say that until unless we don't have a short guidelines regarding the same, I will still say plain paracetamol would be good enough to avoid any type of usage other than paracetamol in viral infections. You can safely use paracetamol.
Dr. Abhi, can steam inhalation be used for COVID infection, COVID-19?
Can
Steam
steam
inhalation be
steam
used,
inhalation.
steam inhalation be used for COVID-19 infection.
First, you need to get infected, then you can try. Well, basically, if you believe that it does not survive above 27 degrees, so it is not that steam inhalation will work. It can first, before it goes to your lungs, it is affecting your throat. So a warm water would always help into taking care of that infection. But all these are WhatsApp
WhatsApp myths.
myths, so nothing is for sure.
One
How?
question. One question. How to use a ultrasonic cleaner?
Pardon?
How to use ultrasonic cleaner?
How to use a ultrasonic cleaner?
How to use?
And is
It
it
is there
really
a lot.
effective?
Is it
Yeah,
how effective it is?
it is very much effective. The moment you are using an ultrasonic cleaner, it is better than cleaning the instruments with your hand and soap water. You can place your aldehydes in that, place it in the water, and then that's how you can use your ultrasonic cleaner. It is definitely effective. My implant instruments post surgery are always placed in these ultrasonic cleaners and before going into for sterilization,
Okay,
because
people
there
are
are many areas where plain I, some something is there where there are many areas, the lumens, the drills, where plain cleaning is not there.
Dr. Amit, since
I
in
think
this
it is
yes,
time
yes.
for
People are moving towards the gallery.
so
Though
balcony,
it's
yeah.
not 5, let's move towards the balcony. I'll be
Uh,
leaving the computer and I don't have any control over the computer for next 5 minutes. Let's move to the balcony, please.
I think Jason, there is still 5 minutes left out. I think we end up our webinar here right now.
Sure.
You announce the next date of the webinar right now,
Uh,
and anybody who wants to ask any questions, the WhatsApp group which is there right now will be effective for 24 hours more. Dr. Amit Gupta will be answering your questions on the webinar group for the next 24 hours.
sir,
Thanks a lot. Thanks a lot, Dr. Amit.
let's proceed to the balcony. There is a lot of disturbance.
Okay, thanks a lot, everybody. There is one announcement on the news. There is Maharashtra lockdown till 31st March. Maharashtra has been locked down till 31st March. It is the recent update. And thanks a lot, everybody. Thanks a lot. Once again, we'll be giving you the next date for the webinar. We will be continuing this procedure again and again, these webinars again and again. Thank you, everybody.
Sir, let's proceed towards the balconies, please.
Let's proceed to the balcony. We'll keep this computer screen same way right
Yes,
now. Okay?
yes.
Yeah.
क्या कर रहे हैं?
Come over here, beta. Just stand over here. Just stand over here. Nothing is to be done. You just have to clap. आपको पता है किसके लिए क्लैप कर रहे हैं? जितने सारे बेबीज है ना उनके लिए क्लैप कर रहे हैं क्या? क्या दिखेगा वीडियो में?
People are really talking about clapping.
वीडियो में कुछ नहीं दिखने वाला है। See, people are clapping. No, you just have to stand, don't do it. Just stand over here. Nothing has to be done. Bas.
क्या है वो? क्या चिल्ला रहे हैं? They're giving value. What is it? God alone knows. Maybe 5 minutes. How much they are going to clap?
Hey, hi प्रतिभा.
Hi.
अरे काय चाललंय
कौन से
सगळ्यात?
पेपर आपको मजा है? सुना ही
तू
नहीं था. पता नहीं चला.
सामने तू ही है.
हाँ?
सामने तू ही
क्या?
है.
हाँ,
अरे
ओके.
तू समोर आहेस.
ठीक है. हाय.
बाकीचे कुठे आहेत?
मी
बाकी
घरी आहे.
ते सगळे टाळ्या. अरे सगळे गेले टाळ्या मारायला.
हा?
सगळे गेले टाळ्या मारायला.
हो, मी तिकडे गेले माझ्या बाल्कनी मध्ये पण नेटवर्क नव्हतं म्हणून म्हटलं जाऊ दे.
नाही
तू
बाकीचे
काय तू
सगळे
नाही गेला का टाळ्या मारायला?
नाही हो. टाळ्या पब्लिक भरपूर मारते टाळ्या सगळ्या एरियामध्ये.
आय स्वेअर एक मच्छर. आज सब लोग वही करने वाले हैं. विरल देख, विरल बाल्कनी में जाके पूरा.
विरल तर तिकडे गावात आहे. तिकडे काय टाळ्या मारतो काय माहित.
अच्छा,
तिथं पालीला आहे.
फार्म हाऊस. अच्छा,
पालीला आहे तो. तिथं उलटा आहे. टाळ्या मारल्या तर सगळे गावाले येतील. काय झालं यांना म्हणून.
लोक सिन्सिअर
गावातल्या लोकांना माहित पण नसेल विचारायला.
हाँ।
अरे खूप मारतात इकडे तर आमचं फुल एरिया एकदम धमाल चालू आहे. म्हणजे
अमृता
मला वाटतं घरातलं प्रत्येक भांड एक
काय
भांड
बोलते?
धमाल खराब होणार आहे. प्लेट्स वाजवत आहेत. अमृता कुठे आहे?
ऍक्च्युली माहिती आहे का आमच्या इकडे स्टेडियम मध्ये जिकडे सेंटर आहे ना म्हणजे जिकडे सगळे टॉवर्स दिसतात ना तिकडे घ्यायला पाहिजे. माझी साईड एकदम बॅक साईडला पडते म्हणून दिसत नाही. ऍक्च्युली इट विल बी फन टू रेकॉर्ड. इट्स अ मॅडनेस यार. खरंच लोकांनी टाळ्या वाजवायला घेतलेत.
अमृता आहे स्पेशली. अमृताला आपण स्पेशल प्राइज देऊया नंतर काय मारण्यासाठी.
अँड दॅट विथ द शॉकिंग त्याच्या मागे लॉजिक की टाळ्या वाजवण्याने काय होणार आहे, कोरोना कसा मरणार आहे. वाव, आय एम लाईक.
अरे अमृता टाळ्या नाही, अमृता भांड वाजवते. आणि ते अमृता भांड वाजवते.
भांड वाजवते ती.
टाळी इज बेटर. मग
त्यामुळे तिचे सगळे कोरोना मरणार आहेत.
अरे वेड लागलेला आहे सगळ्याला.
वहाँ पे।
At least clapping is better than banging a vessel. Yeah.
हाँ
Clapping is better than banging a vessel.
वेसल सांगायला होतं. क्लिनिंग द वेसल सांगायला होतं. सगळ्या घरातली भांडी धुवून निघाली असती.
रुचिताचा चेहरा, रुचिता is so serious.
काहीतरी असतं ते cheer up करण्याकरता लाईक बसून बसून जे कंटाळले त्यापेक्षा ते म्हणतील टाळ्या मारा टाळ्या मारा.
5 वाजता बूस्ट ऑफ एनर्जी. चलो anyway I am logging out.
चलो me too. Bye.
चलो bye bye.
Bye.
How do you log out? अरे how do you log out यार?
I think मैं भी वही देख रही थी.
अरे how do you log out? मी याला fully log out
लॉग आउट के लिए मोर में जाना. मोर में क्या है?
विपुल है.
हाँ विपुल है.
हाँ विपुल है विपुल.
हाँ विपुल.
विपुल. हाँ बोल.
हाँ विपुल ऐसा है अभी दांत में भी डीके आया ना ऐसा पब्लिक मारेगा कोई आने वाला नहीं अपने.
Hi. You're not in your space. You're not in your space shoot. I heard you're in your space shoot.
अच्छा स्पेस शूट अभी नहीं है ना. अभी क्लिनिक में नहीं है.
स्पेस सूट किधर है आपका?
वो क्लिनिक में.
स्पेस सूट.
हाँ
कुछ नहीं ऐसे ही मजाक कर रहा हूँ. अभी घर पे है.
अभी घर पे है ना वही तो बोल रही हूँ.
कुछ ना कुछ ऐसे. हाँ बालकनी में झूले में बैठे हो क्या?
यस गजीबो पे.
बालकनी में. गुड कूल.
एक्चुअली 6:30 बजे ना
तू पण भांडी वाजव जरा.
तो वो सब लाइट करेंगे. अभी नहीं हो जाएगी.
अरे पण तू पण भांडे वाजवायला पाहिजे प्रतिभा. या आय कॅन सी.
का रे का वाजव.
तू भांडी वाजवायला पाहिजे. अरे ती अमृता भांडी वाजवते ना मग तिथलचा कोरोना तुझ्याकडे येईल. अमृता भांडी वाजवते.
यार कोरोना पॉझिटिव्ह की काय?
नाही अमृता भांडी वाजवते ना तिकडे.
अच्छा जशनने सांगितलं नाही हाऊ टू लॉग आउट.
नाही आय डोंट नो. त्याने स्वतःही लॉग आउट केलेलं नाहीये. पूर्ण सेशन चालूच आहे आता पण.
ते बाल्कनीत गेलेत ना. दे आर ऑल इन द बाल्कनी.
येस दे आर ऑल इन द बाल्कनी.
फनी. मला खरंच मजा आहे. लोक एवढी वेड्यासारखी फॉलो करतात ना. चलो ठीक आहे गुड.
चलो लेट्स सी हाउ टू लॉग आउट नाउ.
Actually, more not actually. I think you just come out. That will also
stop. नाही
button down.
नाही गेलो बाहेर मी तरी पण हे लॉग आउट होत नाहीये.
ओ लीव आहे वरती बटन आहे बघ लीव.
हा लीव आहे बरोबर.
हा लीव आहे बटन. लीव लिहिलेलं आहे रेड ने. तुला रेकॉर्डिंगचं बटन. हॅलो तू स्क्रीन वरती टॅप कर. टेरेस पर बोला पण असेल लोक पोतपोताना टेरेस पर असेल.
Hello. Hello. Is anybody here?
ग्रॅटिट्यूड फील करायचं बोलायचं.
हाँ अमित सर क्या बात है? हाय कैसे हो आप? बढ़िया.
नानी का फोटो नानी ने कैसे घंटी बजाई?
विराज सर मजा आ गया. विराज सर मजा आ गया.
फोटो नानी ने घंटी बजाई.
मजा आ गया जशन, बहुत मजा आ
हाँ
गया.
सर मजा आ गया एकदम.
This proves the unity of India.
Yes sir.
अपने आईडिया में भी यूनिटी कम नहीं है. So the enjoyment.
Definitely, we all made it a very great success.
So I think so. Dr. Jashan.
Oh!
Come on, clap everybody for yourselves here. Come on. Jashan.
हाँ सर.
सर देखना इधर ऊपर है ना, there is showing something recording करके.
हाँ सर किया
क्या है ना? Now we can create it as a YouTube channel and YouTube send it to. But after a week.
Already have a idea MWSB na, so you can post it on that.
But it is going to be after 1 week. अपना next webinar हो जाएगा. उसके 2 दिन पहले. नेक्स्ट वेबिनार का जो डेट है उसके 2 दिन पहले हम लोग उसको लिंक देके YouTube पे. अच्छा वरना दूसरा.
ठीक है सर. I am ending this meeting right now.
वरना यूएन बिना
इसी पे बात करते हैं.
जशन नेक्स्ट पोस्ट इसका कब कर रहा है तू?
सर इसी में डिस्कस करते हैं ना.
Okay, no problem. चलो. Shall we end up this meeting now? Shall we end up this meeting? Only 15 participants are. Only 16 participants are left out now.
हाइट क्या है ना, इससे मोटी दिख रही है.
अभी सब दिख रहे हैं मुझे साथ में.
हाइट कम है ना.
Any questions and anything can be taken in the
मतलब
group.
उसने ऑपरेशन पहले करा लिया क्या?
Yeah. Friends, thanks a lot everybody.
Messages only.
Thanks a lot everybody.
Corona go Corona go.
Go Corona.
Go Corona, go Corona.
Jashan.
हाँ sir.
Jashan, end the meeting. End the
Okay
meeting.
sir.
And we'll
Okay sir.
discuss it on. Okay.
Okay sir.
Enjoy Maharashtra lockdown till 31st March. Maharashtra lockdown till 31st March.
Go Corona go.
Go Corona.
Bye.